everything get finalized with HR and all that?
Yes, I just gotta
Okay.
drop off after
He has
this.
a social secretary.
Okay.
Yeah, I just don't want her to overwork herself.
We did, a bunch of us.
Everything off, I didn't know we actually got one of these, so that defeats the purpose of
I get invited a bunch.
However,
Good morning, everyone. Sorry. Okay, I'd like to call the January Advisory Board of Health to order. If we could rise for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
So are we going to do a name roll call, or do we want to just let the minutes reflect those that are present?
That is perfectly acceptable. Okay, appointment of a temporary chairperson. That goes to the secretary.
So I just nominate
No,
Or
you
appoint.
become the chairperson until the new
election.
elections.
Okay.
Mhm.
All right, so at this time, we will take nominees for, we start with the chair, for the chair position of the board.
I would like to nominate Monica as board chair. Second.
I'll s-
I'm sorry, can you speak up, please?
Second.
What was the first?
I would like to nominate Monica Standell as board chair.
Any discussion? Do you accept nomination?
Okay.
All those in favor, say aye.
Aye.
Any opposed? All right, motion carries. Congratulations, Monica.
Thank you.
And then you take over, right?
You can, yeah, turn it back over to me.
Okay.
Moving on with vice chair position.
I would like to nominate Carolyn Richards for vice chair.
Second.
You accept that? Would you accept that?
Yes.
Is there any further nominations? Further discussion? All in favor?
Aye.
Aye.
Opposed? That motion carries. Congratulations.
Thank you.
Secretary.
I would like to nominate Leanne Klink as secretary.
I'll second that.
Is there any further discussion or nominations? All in favor?
Aye.
Aye.
Opposed? That motion carries. Congratulations.
Thank you.
Okay. Now she's going to hand it over.
Right?
Okay, minutes from December of '25. If there are no.
Madam Chair?
Yeah.
I move to correct the minutes, section 10F, and strike that the motion failed in 10F. Per Robert's rules, abstentions are not counted. Motions of this board are passed by a simple majority. Therefore, with one abstention, it was still a 3-2 vote, which is a simple majority. And there's nothing in our bylaws that state that it needs a 2/3 vote, so.
Okay, I would like to look into that, but, okay. Any others?
Does that need to be seconded then, Monica?
Yes, promotion does, yes.
I will second that motion.
Although really, it doesn't have to be a motion form, it's a correction.
That's why I was asking, do
Yeah,
we need that?
yeah, it doesn't really
Okay,
need a motion.
that's why I was
it's a
asking.
correction. And if we can note the correction and then just double check it. Yes.
Just two things.
Uh-huh.
Two things. If you have a correction in the minutes, then you need a motion to accept the minutes with
As
that
corrected.
correction.
Yeah,
And you also skipped over citizens wishing to be heard.
Oh, I'm sorry.
I think it was out of order.
Yeah. I did. Okay. We'll come back to the minutes, since we don't have an actual motion to accept the minutes, so. Citizens. David Hoffman, followed by Mark Smith.
Good morning, Board.
Good morning.
Pastor David Hoffman from Fort Gratiot. I'd like to open with prayer if I could, please. Heavenly Father, we come before you together in gratitude for those who have seized the opportunity to serve on this Health Advisory Board. We ask that you grant your servants the wisdom and guidance as they make decisions that impact the health and well-being of our community. Grant them clarity as they navigate the challenges before us. May the discussions be filled with understanding and compassion, respect for all voices. Help us to remember that the work they accomplish affects many lives and inspire us to prioritize the health and the safety of those that are served. We seek your strength for these, your servants, to carry out their duties with transparency and integrity. May we work collaboratively, always striving to find innovative solutions for the betterment of our community's health. Bless our efforts, and may we be a source of hope and healing. Guide each to be advocates for those who cannot speak for themselves, and instill in us a deep sense of responsibility to fulfill our mission, their mission, with love and diligence. In Jesus' name we pray. Amen.
Thank you.
Thank you very much.
Thank you. After Mark Smith will be Vicki Blackburn.
Good morning, Commissioners, Doctor, fellow citizens. My name is Mark Smith, Birchville Township. I'd sort of like to briefly reiterate what Minister Hoffman just said, more from a secular standpoint, I guess. But I just want to explain that recently I've heard more and more concern in the press and public that there are questions and possible changes coming regarding the administration of our local county public health system. And I just want to remind all of you that there are two sides to almost every issue. And as the first letter in the title of this board, Advisory Board of Health, states, you are advisory. So I'm hoping and praying that when you advise the County Board of Commissioners, who have the final decision to make, that you give them both arguments, both sides. One might be the majority, one might be the minority, but there's usually more than one side to an issue. I believe that we should try to keep politics out of it and look at policy and procedures based on evidence-based best practices, decisions based on science, or advisories based on science and not politics. I guess that's basically it. I'm hoping that you are objective and you do your job and you don't just do what somebody tells you to do. Thank you.
After Vicki will be Mary Lou Creamer.
I just decided to change what I was going to say. I was going to talk about the $180,000 the abdication of responsibility with 4 members not showing up. Going to talk about the political gamesmanship. But I'm thinking, I'm sad. I'm just sad that our county conversations have devolved. I feel like I've gone down into the swamp, and I'm thinking about doing things that I would never in a million years have thought I would be doing or saying, including speaking here all the time at this podium. What I can say to you is I am no Senator Cassidy. Senator Cassidy knew full well that Kennedy was not qualified. Full well. He made it clear. And what did he do? He negotiated for a weekend, came back and said, well, if you agree not to get rid of the vaccine panel, I'll approve you. So, of course, Kennedy said he would agree to that. I had this conversation with our medical director, and I shared my concern that Kennedy did release that vaccine panel. And our medical director shared with me that sometimes politicians change their mind. And I offer to you respectfully, as much as I can be, thinking and believing that people are going to die as a result of these policies that are boisterously presented at the last minute with no plan in place. My thought is that's the problem. Our medical director position is not a political position. Politicians change their minds. So what does that mean? And I want to know which one of you is going to be ready to be accused of horrible things when our children are hurt due to the lackadaisical, irresponsible way that you're discounting science. I don't want politicians in charge of my health. I don't want them in charge of my community's health. And I really
Your time is up.
appreciate the time to speak.
Thank you. After Mary Lou will be Fred Fuller.
Good morning. I'm Mary Lou Kramer, and I live in the city of Port Huron. I have spent my entire working career working with people at the health department. I have a pretty varied past in the medical world, education-wise and through personal experience with my family. But let me be blunt. Dr. Nevin is not good for public health or St. Clair County. As I said, I spent 35 years in my career working with the health department, both medical directors and health officers, all of whom had public health of St. Clair County at their best interest as their focus. This is not the case with Dr. Nevin. For example, county vaccine numbers are horrible. As a member of the Blue Water vaccination project, we have spent years studying these numbers. They haven't improved at all. I went and looked this morning to see where we were at. We're still ranked for child vaccines in the bottom group, the worst group by the state of Michigan. I'm a child of the vaccine generation. They came in while I was growing up. I only had 2 childhood diseases, both sets of measles, and I was so young I didn't remember them. So I was virtually a guinea pig for every vaccine that came down the pike. And I'll tell you, I'm glad I got them. I'm glad my brother got them. I'm glad all my friends got them. and I want to see our children continue to get them. If you stroll through any cemetery, and you will notice before 1965, those cemeteries are full of children's graves, children who died from illnesses that we have maybe not prevented, but we have almost eradicated. Measles, mumps, whooping cough, all of those things. We did that with vaccines. And we can't stop doing that. And Dr. Nevin is an anti-vaxxer. And so I ask the anti-vaxxer, how are you going to fix this problem? Thank you.
Thank you. Fred Fuller, followed by Amy Nelson.
Hi. Thanks for the opportunity. I'd like to ask Dr. Nevin a question. I know that you're concerned, have a major concern about individuals having choice on vaccines. And generally, I think I agree with that. But do you support the COVID-19 vaccines and the flu vaccines? And as the medical officer, I think you should be advising people to get those vaccines. Do you agree?
It's not an open forum for discussion.
Okay, so I can't ask him any questions.
You could ask him after the meeting, but we don't respond.
Okay. All right. Well, maybe I'll answer for him that he has been discouraging people getting vaccines. I think I started to tell at the Board of Commissioners about my son who is only 25, but he has conditions that make him eligible for a COVID vaccine and make it necessary to have a COVID vaccine, in my opinion. We tried to get him a vaccine at his doctor. His doctor didn't have the vaccine at the time. We tried to get him a vaccine at another pharmacy, didn't have a vaccine then. That particular pharmacy was out. So I called the health department, which says, you know, you can walk in and get a vaccine. And I was asked what his age was, and I said 25, but he has underlying conditions that make him eligible. And they said, well, he'll have to get a prescription from his doctor, bring that in, and Dr. Nevin will have to approve it. Well, we didn't have time to do all that. Fortunately, after a while, I mean, he had to go back to college, and after a while, we eventually got a vaccine at CVS, finally. But that's what I call discouraging vaccinations, and I think that's Dr. Nevin's position. Thank you.
Thank you. Amy Nelson, followed by maybe Jake Howard. I'm guessing at that. Jake, I think.
Good morning. Thank you for giving me the time to speak today. My name is Amy Nelson. I'm a former RN of 20 years, and I'm out braving this weather because my current passion is fighting for medical freedom, especially vaccine choice. As far as the new CDC guidelines, not one of you in this room has had the previously recommended 72 doses, and yet here we all are. I would argue that we have swapped short-term illnesses for long-term chronic disease in our children. But I'm going to use the rest of my time to read a statement from a mom in another county. She says, I want to begin by acknowledging that although I do not live in your county, I'm writing because what happens here truly matters. When leaders choose to stand for truth, integrity, and the rule of law, their example reaches far beyond county lines. I am writing to express my sincere support for Dr. Nevin and the changes he is courageously working to bring forward. As a woman of faith, I believe our bodies are not accidents, but intentional creations. Scripture tells us that we are fearfully, wonderfully made, and with that truth comes a responsibility to treat health decisions with reverence, honesty, and care. Those decisions should not be guided by coercion, fear, or policy shaped out of convenience or outside pressure. I wholeheartedly support Dr. Nevin's effort to restore medical freedom and medical privacy. to return public health to the real science that generally improves outcomes, and to ensure that health department is following the law as it is written, not enforcing invented regulations. This matters deeply because when institutions drift away from the law, trust is broken, and without trust, public health cannot truly serve the people. Many individuals have had difficulty exercising their basic medical rights. The challenge of obtaining waivers, to find doctors who respect consent, schools improperly exposing protected medical information, families being forced to filter fluoride out of their own water, workers being pressured to accept medical interventions just to keep their jobs. These are not theoretical issues. These are real hardships affecting real families, families that are trying to live responsibly, faithfully, and within the bounds of the law. What stands out most to me about Dr. Nevin is his expertise and character. He genuinely cares about people. He listens and leads with humility. He's willing to stand firm even when doing so is uncomfortable. I wish more physicians embodied these qualities. My faith teaches me leadership is stewardship, and although it's meant to be exercised with compassion, restraint, and accountability, Dr. Nevin's approach reflects this leadership. While I may not be a resident, I sincerely hope and pray my own county and many others will follow suit. Communities flourish when leaders choose transparency over fear, truth over pressure, and service over power. Thank you.
Thank you. Is it Jake Howard? Jane. Jane. That'll be followed by Andrew Eberly.
I'm not used to public speaking or anything like this, but I do feel passionate about the health of our community, and I just can't stand by and see things happening here. I welcome the new members of the advisory board, and I hope that you all take your role on this advisory board as a very important position. You are responsible for advising the county commissioners on how to act regarding the health of our community. At the meeting, when there were applicants for this position, I heard a lot of talk about family values and morals and faith and all those things, which are wonderful. They don't necessarily fit into the qualifications of the positions, but for me, family values means taking care of your family, everybody in your family, your extended family, your community. And when you have someone in your family who is sick or loses their job or doesn't have access to benefits, most families will rally around them and help them out. And I think that's the job that our health department should be doing when we have families who are going to be losing their access to health care because their benefits were cut, or they have pre-existing conditions that aren't recognized now. They can't afford the deductibles. So we have to take care of those people as members of our community. And if they get sick, they put the rest of us at risk as well. So this is not the time to be limiting access to services for people who can't otherwise do it. The emergency rooms will be overwhelmed. That's another reason that we need to take care of those people. People on Medicaid may not have access to doctors who accept their plan if they can even get an appointment. You can't take away services without having an alternative in place for them to fill that gap. All of our citizens will be at risk if our health is compromised. I think the department should be focused on also food safety, inspecting the restaurants. I've heard a lot of people getting sick from eating at certain establishments. So I'm running out of time here. But I really hope that you'll consider all those things and people's opinions who may not always fit what you think. This is what is best for the community. Thank you.
Thank you. Following Andrew will be Kim, starts with an S. Okay.
Good morning and congratulations to the newly appointed members. My name is Andrew Eberly. My family lives in St. Clair County, and we enrolled our sons at Armada through School of Choice. Our sons were removed from Armada on October 31st. I attended the last 2 meetings here regarding this, and I'm here today to give an update. Our situation began because our trust in MDHHS and local health departments has eroded. We attempted to keep our sons' enrollment strictly between us and the school. We declined the vaccine education session because it comes with a registration piece. Instead, we submitted a written statement of exemption to the school as allowed by the original 1978 statute. Our statement was rejected, and our sons have been removed from school unless we submit to the invasive requirement of registering our sons with the local health department. Through our situation, MDHHS has exposed the true motivations of 2015's Rule 12 are to register student health information, not protect public health. If parents refuse to hand over private data, schools are directed to bar those students from class. This proves MDHHS does not have the best interest of students in mind. I do not believe they have the authority to deny public education, yet they are doing so and must be held accountable. My sons remain homeschooled until this is sorted out. Armada School's leadership has prioritized unfair policies over their own students. They targeted my family by reporting my sons as truant. A deputy was sent to my house the very day my sons were denied entry at the school, despite their having nearly perfect attendance. In November, Dr. Nevin and this board approved a confidential appropriateness exemption letter to get my sons back in school without the registration piece. However, Armada's superintendent shared that confidential letter with MDHHS and other agencies. MDHHS then issued a memo claiming Dr. Nevin's solution was improper and demanded their specific forms. Who is responsible for child's education and has the authority to make enrollment decisions? MDHHS, the health department, schools, or parents? Who has the authority to dictate to parents that their healthy, well-behaved child cannot be admitted to public school? MDHHS is advising schools to remove healthy children from class solely because parents refuse to be placed on their appointment registry. Our goal remains accessing public education while maintaining privacy against an organization that obviously has motives contrary to ours. I thank Dr. Nevin and this board for your efforts to keep MDHHS out of our private business. Your work will positively affect students across Michigan. I've placed details of my situation at letthemlearnmi.net to assist other parents. I hope MDHHS is soon forced to recognize that their role is not to make school enrollment decisions. Thank you.
Thank you. Following Kim will be Kristen Seacree.
Good morning. This morning I saw on the news that there's another outbreak of measles in Lower Michigan. And so that has me concerned because of the non-vaccination, what do I want to call it? I can't think of the word, but because our director does not believe in vaccinations. So I pulled up a website, and I'm sorry, I clicked it, and now I can't see where I got it from, but it shows St. Clair County. You put the zip code in, and it shows you your risk of measles outbreak. And so I put in St. Clair County, and part of St. Clair County, including Port Huron, shows at medium risk. Above that, there are 2 counties in our, or 2 townships, I'm sorry, in our county that are at very high risk. So my question to you is, with the spread of measles happening, and with the fact that our herd immunity has gone down so much because of so many people that have decided they know better than science, what are we going to do in St. Clair County to be prepared for outbreaks should they come? Do we have any vaccines at all? Can people get them? Are we going to have clinics like we had when I grew up where you had to go somewhere to get your shots? Because I'm concerned what's going to happen. We need to protect those that can't protect themselves, such as babies before babies are able to get their shots for measles, for people that are undergoing cancer treatments, people that are immunocompromised. What are we going to do to protect those people? Thank you.
Next up after Christine will be Sandra Tannehill.
So as I look around this room today, I believe that we are all of the age that our parents, with their morals and their values, whatever faith background they came from, and the scientific evidence of the time, brought us all to a pediatrician, and we were all vaccinated. I did not have to sit in an iron lung like my mother-in-law, who had polio. I would imagine that if there was something like that that were to threaten our children today, like having to sit in an iron lung, our morals and values that all of you all talked about at the last meeting that I came to, the morals and values might drive us to doing something to prevent our children from dying of an epidemic or having to sit in an iron lung for months at a time to recover. Thank you for the polio vaccine. I remember when my children would start school every year, that big fat packet would come home. My children went to school here in St. Clair County in the 90s, and that packet would come home and I would fill it out proudly. Many of my children's vaccines came from St. Clair County Health Department, and I was so thankful that I could go there and I could count on someone to make sure that my children would go to school healthy and come home healthy. I understand that we all come here with conditions and biases and faith backgrounds, but we do not want our children to die. We do not want our children to become unnecessarily sick because we are counting on some kind of ridiculous, non-scientific idea. I beg and implore the common sense and the science that has come through all of our lives that we've been here. Everyone in this room, I can guarantee you, our parents took us to get vaccinated. They may have been on church on Sunday mornings praying their kids wouldn't get sick, and that's beautiful too. But they needed the scientific evidence to go behind it as well. Also, by the way, recommended amounts of fluoride in our water keep our teeth healthy. I grew up in a community in Detroit area where we had to have fluoride in our water for all of the high-risk population, people who couldn't go to the dentist. I also remember going to school and getting a little orange tablet that would show all the things in my teeth so that when I went to the dentist, my mom could say, I don't think we're doing a really good job keeping her teeth clean. What's going on? Well, let's look at the fluoride levels. Please, please, I beg of, oh, and also, by the way, mental health, people who have OCD, ADHD, clinical anxieties that come from the deepest part of their brain systems, prayer does not take that away. Scientific evidence and help with lots of medications and talk therapy help, not prayer.
Sandra Tannehill, followed by Libby Pearl.
Good morning. I didn't plan on speaking today, but I thought I'd stop by. I just wanted to say I'm appreciative for all the decisions that have been made, other than the combination of the position that is causing division. I truly believe functions and responsibilities would be more beneficial removing the division. It's been clear for over a year the way professionals are behaving, like removing consent from the county and health board isn't working. The hate groups on social media and now just showing up are real. We all have the right to an opinion, and I appreciate that, but the lies and untruthful comments are flagrant. Children are over-vaccinated, and that's my opinion. Why? Formed by retiring from the medical field. Working for the president of the Pediatrics Association, I witnessed firsthand the vaccine risk outcome. It's real. The doctors I work for weren't in denial, and I'm thankful it's now being taken serious. Parental consent and rights are a must. You can't take away a shot. There are two sides of every decision, and I'm grateful the right choices are being made. My choice supersedes those that are making claims the vaccines aren't available at every corner pharmacy or doctor's office, and Dr. Nevin is taking that away. That's not true. I'm grateful we're looking at the repercussions of mass medication like fluoride. I'm 54 years old. I have not had fluoride in my water. I'm a drink from a well water. I have not had cavities in 15 years. My daughter is a teenager. She went to a dentist Monday. She has not had any fluoride in her water. She brushes her teeth daily. She has not had a cavity. If you want proof, I can give it to you. I just want to say thank you, and I'm looking forward to seeing the positive outcomes this county can continue to make. Thank you.
Thank you. Libby Pearl, followed by Tracy Berge. Folks, let's keep it.
Yeah, for that statement, that's ridiculous. We are on a whole house filter that filters out everything, reverse osmosis, right? The red light and all that kind of stuff. My grandchildren have never had a cavity. They do. I have great teeth, and I don't use fluoride either. Okay. Wow, here we are again. I thought with the change in board, some of the, I don't know what you want to call them, I won't get ugly like them, would maybe stay home. Apparently not. So I think, choice is good. If I said you could not have an abortion, you'd all be out there screaming how your free choice, your body, your choice. But when it comes to my body, my choice, I don't have that choice. You want to force me to have vaccinations that I don't want. Okay, no, that's not true, because Nevin is under attack because he supports vaccine choice. You people have put everything out in social media that is absolutely vile and disgusting. Vicki, you had the nerve to get up here. Stop. Don't interrupt me. You don't have the right to address me. Quiet. It's my turn to speak. I would like time back, please. I am tired of reading the total ridiculousness and the accusations, the abject lies that continue to perpetuate. This is a new board. Joseph, welcome. Thank you for volunteering to step into this craziness. Look, we all have the right to choose. I chose vaccination for me. I chose the vaccination for my family. My daughter is a neonatal nurse. She chose vaccination for her children. The only vaccination I regret is COVID. I had 3, and it took me 3 vaccinations to realize that a life-altering health condition for me was related to that. So I choose not to vaccinate for COVID going forward. I have 2 friends that lost legs, men, who had the blood clots from the COVID vaccine. We all have our reasons for the choices that we make. If you want to vaccinate, vaccinate. I did. I chose vaccination. I'm not worried if my neighbor chooses not to vaccinate. I'm not worried about it at all because I'm vaccinated. I'm protected. If my neighbor chooses not to vaccinate his or her children, they've done it for a reason. It's not for me to judge. If their child gets sick, I'm sorry. But you know what? We also have advancements in medical treatments that, make some of these, diseases perhaps, a little less dangerous. I don't want any child to suffer from any disease. Listen, I had measles, mumps, not rubella, chickenpox. I had that as a child because there were only 2 vaccinations required for me. Do I get my time? Do I get my time back?
I'll keep time. Thank you, though.
Do I get a little bit of time back?
You
Thank
get 4 seconds.
So, how you feel about it? We all come to this individually. I don't think it's the state's place to track what vaccinations I have, where my guns are, or if my grandchildren want to be transgender. Thank you. It's all about choice. Just respect choice.
Kevin. Folks. Tracy Berge, followed by Kevin Watkins. Folks, let's have some decorum. Everyone has the right to speak. We don't always agree with one another.
Happy New Year. I'm so glad that you all are here and that your board has come together to meet the needs of the people of St. Clair County. I am grateful. Thank you. You know, we talk about the science and we talk about where we should be. And I think that if we're truly going to talk about the science and where we've been in the last 6 years, if that has not taught us anything, is that maybe they don't know. They were able to shut down our schools. They were able to take our children's health into their hands, and I want to make choices for my own kids. I don't know about you, but the last time I took my kids shopping, bought my groceries, took care of my children with my insurance, or if they had to go to the doctor, the government did not pay for that, nor did the state of Michigan come in and say, oh my gosh, maybe I can do better than you. Well, you know what? You can't. I am my children's mother. That is the most favorite job that I have. The hardest, but yet I just want people to look at, you know, you talk about choice, and I thought that when I read that memorandum, when I saw it and it said choice, I thought, I don't know about you, but that cannot offend anyone. If you choose to vaccinate, well then, have at it, but if you choose not to, don't do that. I chose to vaccinate my children in the beginning, and then when I started to follow some of these different reports, and I read them from all over. I didn't read them from some kind of crooked little corner that I'm just too ignorant to understand, because I know that is not true. But when we can take time to educate ourselves and choose what is right for our family, that is where I will stand with St. Clair County. I do not need the county to tell me how it is that I should take care of my children. I spend every day looking at them and taking care of them. And then as to about my faith, I think that is an unfortunate comment. I think that we all have faith, whether we choose to come to this church or that church, or if we don't go. But you know what? I can't think that people that don't have faith don't love their children, just like I love my children. But I just think that when people keep saying, oh, let's follow the science, that's so ridiculous. Like, stop. Are you kidding me? These people are doing the best they can by their children. And then when they say, oh my gosh, it's so political, this is nauseating, stop it. It is political, stop. It doesn't matter. It shouldn't be. But a stoplight can be political. People don't like that you have to stop. But the choices that we make for our children here, out, all the time is the most important thing that we can do. And so I just want you to know that I support you all, and I hope that you'll make great decisions for the children and the families of St. Clair County, and I am grateful. Thank you.
Thank you. Kevin Watkins, followed by Bishop Kim Brown.
I've been waiting to say this. Libby Prill, you are a fool. Eileen Tesh is an idiot. And Carol Miller is both. Okay, now, I'm looking at you guys, and it's very interesting. Kevin Watkins from Wells Township. If you don't know me, look me up. Very attentive. Listening to everyone, making them think you're going to consider what they're saying. You don't give a damn. And I know that because I sat up there with you. First, I want to say, why in the heck are we fighting the fight for Armada? I bet you the commissioners at Armada are hoping that St. Clair County fight their problems too. Spending our money. Dr. Devin's part-time, but he said he's doing it his own time, fighting for Armada. Where's Armada's medical director? This is St. Clair County, not Macomb County. That is craziness. You guys are wasting our money. You're throwing back money that's given to us, grant money, to take care of our kids in the clinics, and you using our tax money to fight for Armada, for a person to choose, school of choice to go to Armada. We got great schools in St. Clair County. You go to the Armada medical director to help you. Why are you dragging ours into the fight? That's craziness, and you're all for that. You sit here, you don't give a damn. Ms. Richards, I had great concern until I realized you're not a nurse practitioner. Okay, that you, a Nightingale wouldn't do what you're doing. Okay, I'm looking at, you work with Sparrow, Ms. Leanne, you fight to the death to prevent abortion, but you don't believe in vaccines, protecting the kids. You don't believe in the things, you don't believe in fluoride, things that are going to help them survive and be prosperous when they're born. How ridiculous is that? It's craziness. I'm not sure what the new advisory board members are going to do. We're going to watch your votes. I talked to a couple of you after the meeting. We'll see you saying things. We're going to see you where you vote. And I'm telling you right now, if you think you're going to, after all that fight to separate the medical director from health officer, if you actually think you're going to bring up a motion to bring that back together, and then the same county commissioners think they're going to do that, no, not without some resistance. Strong resistance, because that's ridiculous. You guys, it's amazing. I can't believe it. You know, Dr. Nevin, you still believe that Tylenol is toxic and poison? What Ms. Kristen said about the history. All of you are probably here today because your parents, your grandparents
Your time is
took the
up.
vaccine.
Kevin,
But now you don't believe in it.
time is up. Thank you.
Time is up. Well, thank you. Remember what I stated.
Bishop Kim Brown, followed by Marlene Harris.
Bishop Kim Brown, and have the privilege to serve in our community in different capacities. One as a senior leader of Zion Cathedral of Praise, which we've had the opportunity to work with our specifically our former director, and that was medical director, Dr. Mercantod, and others, when much of this was getting formulated and the issues began to come forth about vaccines and all of these things. We were grateful that through working together, we were able to ensure that our community, all of our community, was able to be serviced, that people that felt like they could not come to the door of community mental health department, that just by sitting down, by hearing outside of their own personal views, were able to embrace that maybe we need to do a better job at listening to all of our citizens. And so it was through that I happened to become personally and more intently involved with the health department. So I just wanted to say that. I'm here to speak today, and I do congratulate all of you who are newly appointed. We thank you for your service. I serve on boards, and I know that it is not easy many times. But I do know that we have to, because I'm also a Christian, a strong believer in God. But I understand that even God himself gave choice, that even he made sure that while there's some absolute things that must be, that people can choose what they're going to do. And that is part of our right as a human being, okay, to do. However, when we stand and we have to make choices on the behalf of all people, it concerned me when I came here last time and I heard somebody say 80% of the county, we have the larger vote, and 20% of the county is this measure of people. So therefore, we don't have to worry about it because we know that we'll always make sure that the majority vote goes forth, or the majority opinion goes forth. That disturbed me because I think that that's what's happening in this country now, that people are feeling that because I'm of this party or that party, that we're not looking deep down inside. And we can say what we want to about it,
Your
but
time
it is
is
the
up.
truth. And so I'm asking that we take a consideration of our own as
Thank
we're
you.
making decisions for others.
Thank you.
Where we're coming.
Marlene Harris. be followed by Diane Hewlett.
Greetings, everyone. I'm Marlise Harris, and I do live in Port Huron in St. Clair County. I am not originally from here. I'm from Atlanta, Georgia. I've lived here for about 3.5, almost 4 years. And it's a new way of adapting in the concepts and things. But what I wanted to address, one thing that I've been concerned about from even when I stayed in another city in Michigan, was the level of fluoride that is in water. I understand, yes, it's good for the teeth, but the problem, it comes adding the addition, which is already in water naturally. If you do your research, fluoride is already in water naturally. It's in the soil, it's in the rock, and it's in the sand. God put it there. However, as we increase fluoride, it is not good for any other thing but the teeth. It's not good for bone, it's not good for muscle, it's not good for your blood, it's not good for your marrow. It's not healthy for anything else other than your teeth. So if you're drinking your faucet water or your bottled water, and those things are added, you don't understand that some of the health issues that we are experiencing, and I see a lot of similar health issues here that I have not seen in other places that I've ever lived. And I'm seeing people with limps and bone issues and back issues that should not be, even for young people. But the foundation, which is our mature people, like yourselves and those that are older, like myself, fluoride is not healthy. It's not even healthy for your gut. And we talk about all these things, a remedy. We talk about medicines that are needed. And unfortunately, we're talking about health of children. But if you're adding something that's already in, too much of something is detrimental. And the thing is, if you're above a 0.5, they say that it's good. But now I'm hearing you want to add more, and you already have more than a 1.5 in the water system. I've tested it. So now you're causing people to be like some in hierarchy who wants to see depopulation. You're causing sickness. You're causing ailments. You're causing these things because no one is actually addressing how much should we put in. And it's not an over thing, because we cannot be those that allow ourselves to be fear mongers and live in fear, because God did not give us a spirit of fear. And yes, I am a Christian. But if we can be bold on the other things, be really sensible about what you're doing. Don't allow higher up, don't allow money, don't allow peer pressure, do not allow government pressure to influence, but please do the research. Thank you.
Diane Hewlett, followed by Sandra Richardson.
Hello, I'm Diane Hewlett from Riley, and I am thrilled to see all the new faces on the board, and I trust that you will all make great decisions. I am in full support of Dr. Nevin, as he has the foresight to see ahead and protect us. And I just have random thoughts as I was going along. Didn't plan on speaking, so not necessarily in order. I believe he has high integrity, and I wanted to make a point that I believe he is supporting choice, not taking away vaccines. That is my understanding. And others' rights do not supersede my rights and my choice of not taking a vaccine. I believe in parental choice. I have heard horrendous stories from those who have taken the vaccines, including 2 nurses. One lost her job, the other one is in a wheelchair and had tears of regret of taking it because she was so debilitated now. And the government does not run my household. They were never there when my kids were growing up and sick. They were not there. I do not count on them now. And I believe between Fauci, the truth will come out. I believe Gates had a patent for COVID vaccine prior to COVID existing. And I believe he'll be charged with crimes against humanity. And I do agree wholeheartedly with the gal that just spoke. And God knows best, he's already put that in our water. To the other gal that spoke, we don't have iron lungs. We have portable ventilators. And I believe the most important message that was said today, I believe, was totally false, and that is that prayer doesn't work. I believe it is always, always the best thing to do, and nothing beats it. So with that said, I appreciate all the new board and all your time and effort to deal with all the things that come across your plate, which is enormous. So I appreciate all of you, and thank you for speaking.
Thank you.
Sandra Richardson, Fort Gratiot Township. I'm here today, wanted to thank the board, and I want to thank Dr. Nevin and Liz King for all the hard work they've done in this community. I think people fail to recognize all the time and diligence and the research they have done on their decisions, whether it be on vaccinations, on looking out for what's best in our community, and processing that and sharing it with local communities and boards and our county commissioners. So I do think there's a lot of work that they've done in our townships and looked out for the scientific evidence on how to proceed. I am not, again, like I said, politically or religiously motivated, and I do believe in vaccines, and I do believe that, I'm not going to speak for Dr. Nevin, but I did ask him after a meeting how he felt on people getting vaccinated, and he definitely said he was not an anti-vaxxer, and he did not, propose that anyone be forced into making decisions that they felt were not good for them. Now, this is just a conversation I had with Dr. Nevin. I also had the experience of going to our local health department a couple of times in December, and I had the best treatment there for myself and another person that I took that was uninsured. So I was never questioned as to why they were there, why they wanted the vaccines. They asked if I would like to speak to a nurse and go over anything that I had questions or concerns on. I found it more helpful than 3 pharmacies I went to that were unable to provide some of the vaccines, which I understand. They don't have vaccines for some people. So with that, they guided, this person I was helping to the local health department. They had no problems getting vaccinated. And I would, encourage anyone in the community that sees someone that would like to go to, get vaccinated to help them do that. So again, I had the personal experience myself. And I think everyone in our community has the right to make a choice. So with that being said, if anyone wants to speak to Liz after the meeting or Dr. Nevin, they always stay around and would do anything to guide anyone on how to get medical help at the health department. Thank you.
Thank you. All right, that concludes the public comment unless anybody else that has not spoke would like to speak. Yes, sir. Yep, I just need your name.
My name's David Squires from Port Huron Township.
Okay.
When I'm here, I'm intended this because I was curious as to what was going on. And I'm hearing people saying, follow the science and the science. Does anyone here still trust science? Does anyone still trust the science after the mRNA vaccine and the documents that are now coming out, if you take the time to look at it, on how Pfizer did the testing and everything? They didn't learn how to do it at this point. And this is not a question of vaccine or not, it's a question of choice. To be able to choose what is best for your kids. We had our kids vaccinated, but we did it over time. We didn't let them, this was back in the 80s. But we went 4 different appointments to get them broken up, so it's not like 72 all at once like they do today. My grandchildren were taken in, and my kids were going to do the same with their grandchildren, but the doctor, nurse stepped out with the child, and they were talking to the doctor, came back in, the kid already had over, all his they put over 72 vaccines in the kid. And it's the type of thing is that this, and I guess it comes down to personal, experiential means, is how I judge things. This is the same science that was telling us, and I'm going to go to the side, ivermectin was horrible. I know 5 people it saved their lives. One was my aunt. And it wasn't the MRA vaccine that did it. I do know also that in personal experience, I have a dear friend who had her kids vaccinated probably about 15 years ago all at once. Within 1 week, they started showing signs of autism. Now, you're going to say maybe coincidence. Both those kids grew up as teens autistic. She did the time to take the research. She did everything. And this isn't a thing for it, but she found out that it's the heavy metals is what her kids, and as long as your kids get okay, you're fine. Her kids did not. She took them to chelation, which removed, if you want to tie it to it, at ages 2 and 3, where were you going to get heavy metals in your body? But these kids, basically, through chelation, their ability to function doubled. But this was after they'd already spent 13 years, just removing the heavy metals from their blood. It's personal experience that it should be parents' choice. That's all I have to say.
Thank you. Is there anybody else that wishes to speak that has not spoken? Your name, please.
I'm from Clyde Township. I don't understand what's happening here, but we're not talking about the same thing. You have choice. Nobody is forcing you to take a vaccine. Today, you don't have to take a vaccine. That's up to you. So why are you standing up here saying, we need choice, we need choice? You have choice. What we're talking about here is the public health department deciding to scale back what they're offering to the public. The role of the public health department is to promote health for the public, all of us. Their role is to promote the things that science, that yes, a lot of us still believe in science. I know that's crazy. I can't believe we've got nurses and doctors up here who don't believe in science. Fantastic. It's an embarrassment. It's an embarrassment to be here. If you have a medical license of any kind, you should lose it over this. You are sitting here saying you don't believe in science, you don't believe in vaccines, you don't believe in promoting health, you think the health department should just be about solar and what else, Dr. Nevin, would you like to do? Dr. Nevin knows what's going to happen when the measles hits here. He's written papers about it. He knows, right? They taught you at Johns Hopkins what matters about herd immunity, why it's helpful to a community, why it's helpful to the vulnerable populations, right? They taught you that. Yeah? You wouldn't know it. We're arguing about things that are not the same thing. So you have your choice. You can stop yelling about it. You can stop begging for it. It's yours. You have it. Leave everybody else alone. Leave the public health alone.
Thank you. Is there anybody else that wishes to speak? Go ahead. Kevin and Vicki, please. Thank you.
My- Stop. My name is Carrie Darden, and I live in Marysville. Just a couple of things. I've been following online some of the things that have been shared and being said, and I would like to say that if we hear this follow the science thrown around so much, if you're really following the science, there's a lot there you're not paying attention to that Dr. Nevin is. You have to understand that the medical establishment, and you have to understand that anything political in government is always political. Him taking a stand to stand up for some of the newer things that are being found, to support, parents. Parents may have choice, but the way it's presented to them, they are not fully informed. They are led right into it. And I've been there with my own kids. I know what it's like to just be led along. You can't understand how many parents in school think that vaccines are mandatory. And I have to tell you, I was shocked when the school contacted me my son's senior year and told me that he was missing a vaccine. I thought, it's my job to report that to you. How come you're reporting that to me? That was when something happened where all of the doctor's offices, the pediatricians, reported all the vaccination schedules up to the state, who shared them with the educational system so that they could monitor us. I don't like this kind of crap. I fully believe that parents are the primary person in charge of their children. I appreciate medical people for bringing the information that they do, but I'm telling you, the medical establishment is captured. I'm telling you that politics is always in play, but the way they like to play it is behind the scenes quietly. When Dr. Nevin starts talking about the political thing right out front, suddenly he's accused of being political. It's like a parent that doesn't see the first punch thrown and only the kid that hits back. This is crazy. Wake up. We need to be aware. And I really challenge people that keep saying, oh, the sky's going to fall if we don't get vaccinated. There is so much research to be done. In my house, we have a ton of books. We always have. We do our research, and we have remained exceptionally healthy. We filter our water. You can't rely on public health. They have a role, but you have to advocate for yourself, and you have to have your choices and your freedoms respected. And what RFK Jr. wants to do, he just doesn't want everything pushed on people. He wants people to be educated. There's so many people that get shots that are really not fully advised as to the risks. It's got to stop. I very much support what's going on with the Freedom Direction.
Time is up. Is there anyone else wishing to speak? We also received into record 2 emails, one from Deborah Roberts and one from Sharon Cortez. Okay. Minutes. Back to minutes.
Should we pick up where we left off?
Yeah, so you would like to make a correction?
Yes.
For 10F on the outcome of the vote?
Yes.
Okay. Okay. That's your correction.
To strike that from, that it failed, strike that it failed from the minutes.
Yep. And then I would like to run that by legal, just to double check that, or I look it up myself. I don't have, I know that book is right there, but, just so that we double check it. Because that will change the outcome of that vote and how it would be forwarded to the Board of Commissioners. So if you'd want to make a motion as corrected, that would be in order.
I move to accept the minutes as corrected.
I second that.
It's been moved and seconded to approve the minutes of December 2025 with the correction of 10F, striking the motion of failed as failed. Is there any further discussion? All those in favor?
Aye.
Opposed? Motion carries. Budget to actual, Greg.
That's the last one of the year. Nothing remarkable about it. If anybody has questions, I'll answer.
So maybe just explain for our new members, calendar year, budget year, state year.
Okay, this budget to actual is calendar year. It's the county's calendar year budget. But our state funding runs on a fiscal year, October 1 to September 30. So what you're seeing here is 4 quarters of the county budget, but 3 quarters of the old grant budgets in the first quarter of our new round of funding for 26, 27. So it's a balancing act to keep it all within the 1-year county budget, which we have done. So, yeah, so that's just the way it's always been.
So just moving forward, no, when things look a little off sometimes, it could have to do with the
Well,
year.
yeah, because some of the first quarter expenses won't be, they won't show up until next year's budget to actual when they get reimbursed.
Correct.
So it's, like I say, it's, you gotta just keep track of it.
If there's no questions for Greg, I'd entertain a motion for acceptance of the budget to actual and recommend the transaction registry.
So moved.
Is there support?
I'll second that.
It's been moved and seconded. Is there any further discussion? All those in favor?
Aye.
Opposed? That motion carries. Liz, correspondence.
Sure. Within your packet, you will see what's included is just my letters to new board members, Mr. Urban and Mr. Hayes, inviting them in there for just a meet and greet and a small orientation, and thank you both, and congratulations. Welcome to the board.
Thank you.
And then also you'll see the letter from the county administration to both new members as well, and then reappointments of Dawn and Steve Smith.
Okay. Unfinished business, new business. Dr. Nevin.
Thank you very much, Madam Chair, and welcome to the new members. So in your packet, you should see a copy of a memo that I took pains to get to you as soon as possible. I believe you should have had this distributed in your email about a week ago, and I hope that's given members of the board enough time to review this. Looking through the packet that was printed, I see an additional page that may be in some of your packets. Following fact sheet CDC immunization recommendations, there may be an email that was erroneously printed, internal correspondence related to some quality control, quality assurance concerns. I would ask that you rip that out because that pertains to some clinical matters we would like to keep confidential. This memorandum on the topic of vaccine choice has been over a year in deliberation and preparation. As I mentioned, you'll recall, members who have been with us for the past year, that I first broached these topics in February of last year. And this was in recognition of the fact that despite many members of the public not wanting this to be the case, that things have changed. Things have changed in public health. And I recognize that many people are still grieving the loss from this change. The grieving process begins with denial, it moves to anger, it then moves to bargaining, acceptance, bargaining, depression, and then acceptance. And we are all at various stages of the grieving process. Folks on the red side, the conservatives, Republicans, populists in our county, they went through this process 5 or 6 years ago when they lost faith in public health. And now, the other side gets to experience the same thing. Public health is going through a schismatic moment. And during schisms of this nature, both sides tend to talk past each other. The other side are marked heretics. They're accused of apostasy. And unfortunately, experience teaches that during schisms of this nature, there isn't really an opportunity for reconciliation and compromise. The majority wins. And so in St. Clair County, we are faced with a situation where it's very clear the majority of our population has rejected the status quo. Despite being universally recommended by our state public health officials, 90% of Michigan residents and an even higher percentage of St. Clair County residents have rejected the state's guidance to get this year's coronavirus vaccine. 90%. Influenza, 75% of Michigan residents, even higher in St. Clair County, have rejected the universal recommendation to get the influenza vaccination. And as much as some of my critics would like to blame that all on me, these problems preceded my taking the position of medical director. I am a symptom of these changes, not the cause of these changes. And I think the sooner we all recognize that, the better. So what this memorandum does is it addresses the very obvious loss of public trust. There are some people that trust public health, good for you, that's great. But the majority of our residents no longer do. And we need to, as an organization, as a board, we need to begin to rebuild that trust, not among the members that will gladly do whatever public health says, but among the majority of our residents that clearly have rejected the standard guidance. So what this recommendation before you does is it proposes a three-point plan. It proposes to formally endorse, as a matter of advisory board policy, and if adopted by the health officer, as a matter of health department policy, it proposes to endorse and promote the new CDC vaccine recommendations, which emphasize choice, which emphasize patient involvement, and which emphasize that vaccines are prescription drugs that really should be a personal choice between individuals and their physicians. The second thing that this does is it helps to empower parents like Mr. Eberly, who have unfortunately been the victim of tremendous abuse and overreach on the part of the state. This empowers them to exercise their statutory right to vaccine exemptions, which is particularly important now that the state's vaccine recommendations differ from the federal recommendations, which the board may be endorsing and promoting. So an example of that I've given in the memo is the birth dose of hepatitis B. 30% of Michigan mothers reject the recommended birth dose of hepatitis B. They elect to get it at some point later in their child's life, perhaps at 2 or 4 months. But because the state continues to support the status quo, the state is imposing a requirement, for example, on daycares, that 2 months old attending daycares have that birth dose. So taking the choice away from the parent, taking the choice away from the physician and the parent, and imposing that choice upon the daycare center, making that a matter of government interest. Parents have always had the statutory right to exempt their children from vaccination, but as the memorandum shows, there have been numerous administrative roadblocks, inappropriate administrative roadblocks, placed in the way of parents. The recommendations in this memorandum clear those away, and it empowers the medical director as a last resort to exempt anyone in the county on grounds of appropriateness. So I would ask that the board consider this particular motion, particularly in light of the ongoing problems that we've heard with Mr. Eberly. And then lastly, the third recommendation, we discussed this at a couple other previous meetings. It concerns the state's vaccine data tracking system. Now, we all recall during coronavirus, paper records of vaccination were a perfectly acceptable and appropriate means of keeping track of vaccinations. Right? These were recorded on a CDC form that was printed out. It was initially anticipated you would get 2. They didn't have enough room for all of the boosters that they later recommended. But regardless, paper records are perfectly appropriate for tracking vaccines, particularly if the number of vaccines is reduced, right? Particularly if a parent in discussion with their physician decides to receive a reduced number of vaccines. Parents in Michigan have an absolute right to exempt their children from having their vaccines recorded in the state's vaccine data tracking system, MICR, M-C-I-R. And in fact, by law, as we discussed at a previous meeting, pediatricians are required at the time of pediatric vaccination to distribute an opt-out form to the parent, informing the parent of their right to opt out of this system and permitting the parent to fill out the form and return it to effect the opt-out. And as I described in the memorandum, compliance with this law has, we think, been very poor in the county. Our own clinical practices did not incorporate distribution of this form until some changes that I mandated last year. So I am recommending that within our powers of the health department, we measure compliance with this mandatory statutory distribution and take steps to encourage distribution of this opt-out form among local pediatricians. For parents that want their child's vaccine tracked in the data system, that's fine. They have the right to do so. But many parents, as we've heard, Mr. Eberly has grave concerns with particularly the abuse of authority that can occur when the state is tracking this data. There's really no strong argument for it, and particularly as more and more parents opt out of data tracking in the system, the quality of the data from this system becomes worse and worse. And we're at the point now where I think the quality of the data is such that we really can't rely upon it to make important public health decisions. So there really isn't a marginal benefit for an individual child to have their vaccines recorded in the system, provided the parent can keep track of these things themselves. So those are my recommendations. I've included a number of exhibits, and rather than continue to speak, what I may propose is that I be available to answer any questions that board members may have on this as you're considering a motion potentially to formally endorse these recommendations.
Questions?
Yes, Dr. Nevin, I do have a question just to confirm. You are saying, or you're, with this memorandum, you're saying that parents have a choice, and the health department is not changing their availability of vaccines that are available to those parents?
Yes,
If they choose to go to
Yes.
health department or
Yes,
Walgreens or whatever, those options will be available to
Yes,
them.
that is exactly right. So I should reiterate, because there's been some what used to be called misinformation on that, including it during public comment at this meeting. So all of the vaccines which have previously been available will continue to be made available, but in fact, the quality of care associated with the administration of several of these vaccines will actually improve. Because now in due course, I should clarify, these recommendations are broad endorsements, right? They're recommendations for our health officer to take specific action within her power. So promotion, advertisement, the measurement of these things, the legal steps necessary to effect promotion and enforcement of these policies. This is all outside of what I do as medical director, which is why I'm bringing these recommendations forward. So these are non-clinical recommendations that are being made. On the clinical side, under what I have control over with my standing orders and my medical direction, I will continue to make all of these vaccines available. If vaccines were available before, they will remain available into the future. What will change is that in certain cases, instead of receiving these vaccines through a standing order without direct nurse practitioner, physician assistant, or MD involvement, without an opportunity for you to have a face-to-face clinical encounter with a trusted medical provider, in many instances, you will now have an opportunity to meet with a trusted healthcare provider, a nurse practitioner, a physician assistant, or an MD, face-to-face, and have any questions that you may have about the appropriateness of these vaccines in your individual circumstances. So you will have an opportunity for a true medical encounter prior to the prescription of these drugs. And this applies particularly to the vaccines for which the Centers for Disease Control now recommends individualized or shared clinical decision-making. And those vaccines are hepatitis B and hepatitis A for children, the meningococcal vaccine, and the rotavirus vaccine. So the decision to get these vaccines, the timing of when to get these vaccines, will now be a choice under my modified medical standing orders, which reflect the new CDC recommendations. These vaccines will be given according to patient preference and with enhanced medical advice. So now in some cases, this may require you to wait a few minutes until one of our nurse practitioners or I am available to effect that face-to-face encounter. But practically speaking, we have not seen a significant change in our workflow, and I met recently with our nursing staff, and we determined, based on the relatively small number of vaccines that we give in our clinic, we give, if memory serves, We gave 1,700 total doses of pediatric vaccine at the clinic last year, which is relatively small when you think we have about 25,000 pediatric patients in our county, and each of them will typically receive at least one vaccine a year. So it's a relatively small fraction of the total vaccine doses given in the county. 700 of those vaccine doses are eligible for this enhanced face-to-face, individualized clinical decision-making encounter. And confirming with the nursing staff, if you can just do the math, that's 2 or 3 extra nurse practitioner or physician encounters a day, and we certainly have enough staff to accommodate that. So from a practical perspective, nothing is going to change for folks that want to get vaccines and who want their children to get vaccines. But what will change is that parents who have felt coerced, parents who have felt pressured into getting vaccines where they haven't had a chance to discuss the vaccine fully with a trusted healthcare provider, who have felt pressured by their daycare center or their school to get the vaccine, who have felt pressured because a computer system is telling them that they're overdue for a vaccine that they and their doctor have already decided they are not going to give. For them, they are going to experience a new era of vaccine choice in St. Clair County. I hope that addresses your question.
Thank you.
Dr. Nevin, would you please explain to the audience, because not everybody in the audience is a nurse or in healthcare, I call it the foundational vaccines, just the ones that will be continued to be given. Would you just please explain that to the audience?
So the Centers for Disease Control and their new recommendations, and if concerned members of the public haven't had an opportunity to review the updated CDC childhood immunization recommendations, I would encourage them to do so. So they're modeled broadly on the recommendations in developed Western European nations. Denmark, for example, has for many years given far fewer vaccines, or has recommended far fewer vaccines than we recommend here in the United States. There's some debate about whether the differences between our countries are such that we should recommend more. But I think from a practical perspective, in our county, the comparison is rather reasonable. And the vaccines that are recommended universally in Denmark continue to be universally recommended here. So there's been much concern about MMR vaccine. The CDC and RFK Jr. continues to recommend that parents give their children the MMR vaccine. Even varicella, which there isn't universal support for administration. I'm on record as having some doubts about the universal appropriateness of varicella vaccine. This is certainly a vaccine that I believe is amenable to individualized decision-making, but I am happy to defer to the CDC recommendations, and they recommend that that vaccine be universally administered. Same with DTaP, right? Same with polio. So same with Hib. So the usual childhood vaccinations that many of us grew up with are continued to be universally recommended under the new CDC recommendations. What's really changed are some of the vaccines that have only recently been adopted under the CDC schedule, and for which for a number of years there was acceptance within the medical community that these vaccines could be given per parental preference and at different times, depending on individualized decision-making. So we're essentially reverting back to the era that many of us remember when there was a core group of recommended vaccines and then a number of other vaccines which were optional based on vaccine choice and patient preference. Does that address your question?
Yes, thank you.
Yes, Dave.
Yeah, just one math question for him. From the figures you just gave, 25,000, 1,700, that's less than 7% of the pediatrics or children that actually come to our county that have actually been vaccinated. So we're talking a very minimal number, only 7% that actually come to our, it's actually under 7% that come to the county.
And this is good. So as I remind my staff, we want our clinic to be empty. We are a public health clinic, which means we focus on preventive medicine, which means the fewer people we have to serve, the more the conditions at issue are already being prevented, right? As I mentioned in my earlier memorandum, we want there to be a vibrant economy within our county of pediatric offices being able to provide these vaccines themselves. We want parents to be able to get these vaccines at a pediatrician's office with a pediatrician that they trust. And there are various programs that we help to administer to make those vaccines available at the pediatrician's office. We can't be everywhere We can't be everywhere to everyone that wants a vaccine, but there are many pharmacies throughout our county. And if you can't get a vaccine at your doctor's office, as long as your doctor approves and you've discussed the vaccine with your doctor, there should be no problem getting that vaccine at the pharmacy, the same place you pick up your other prescription medications. Vaccines are prescription medications. They need to be prescribed by a doctor, and the CDC's recommendation is that it be prescribed by a doctor that you trust, that knows your medical history, that knows your values and your preferences, and that you can make a shared clinical decision with. So the doctor says, yes, we've decided that the coronavirus vaccine is right for you this year. Why don't you stop in at CVS as you're picking up your blood pressure medications and get this year's coronavirus vaccine? No need to come to the health department, right? So the fact that the majority of vaccines in the county, the overwhelming majority of vaccines in the county, over 90%, are given outside the health department is a good thing. That means that it's working. That means that what we are doing in the health department to promote the development of healthcare delivery systems in the county is working. Now, we are a safety net for folks that don't have insurance, who can't access vaccines outside. We are available to provide those vaccines. But the standard of care should not be worse if you're coming to the health department. If your vaccines are given after a face-to-face medical encounter with a pediatrician or with a family practitioner, why should it be any different at the health department? Ideally, you would be able to discuss these vaccinations with a trusted healthcare provider at the health department, either myself or one of our nurse practitioners. So that is the change that we're making. We're improving the standard of care that we're providing for many of these vaccines. But it will still be a very small minority of all vaccines given in the county.
Thank you. Steve, did you have something?
Yeah. So, Dr. Nevin, in the beginning of your statements, you're asking for a recommendation. You had also said that it requires support of the health officer.
Yeah, that's right. So again, let me clarify what's being discussed here. So separate from these recommendations, in due course, I will be updating our clinical vaccine standing orders. As medical director, this is my prerogative to update our standing orders. As medical director, I have authority over clinical decisions of this nature, and I value the input of the Health Advisory Board. I value the input of members of the public into how standing orders should be written, but ultimately I have final say because it's my signature and my medical license on the line with those standing orders. Now, what I intend to do, subject to some additional deliberation and discussion potentially with our staff, is update our orders to more closely mirror the CDC recommendations. So for parents who are coming in simply wanting some of the core vaccines for which shared clinical decision-making is not emphasized, those vaccines, like MMR and varicella, are appropriate to be given under standing order. So I will be updating the orders to reflect that. But vaccines, for example, as we're already doing with coronavirus vaccine, if someone presents wanting a coronavirus vaccine and there isn't a clear indication based on their age, right? If the indication is based on their medical history, then they need to see a nurse practitioner or a doctor to confirm the medical indication. So I've already made that change in our coronavirus vaccine standing orders, and I will likely be updating the standing orders for the other vaccines subject to shared clinical decision-making per CDC. So Hep A, Hep B, the meningococcal vaccines, and the rotavirus vaccine. I'll be making those changes. And at that time, I may be making some additional changes to permit parents who wish to space out the vaccines so that they don't get multiple vaccines all at once, and potentially some other changes. And I'll keep the board informed of those changes when they're made. Separate from the clinical changes, under my authority here at the health department and at the teen clinic, there are a number of organizational issues that I don't have control over, right? So I don't control our public relations. I don't decide when to send out a press release. I don't decide what billboards the health department puts up, as we recall from a few years ago. I don't control the utilization of our public health nursing staff in such things as inspections and data gathering, right? These are administrative organizational matters. So these recommendations broadly outline administrative actions that I'm recommending that the health officer take at my recommendation and at the recommendation of the Health Advisory Board. So explicitly promoting and endorsing the new CDC vaccine recommendations, right? This is the official position, if endorsed, this is the official position of the St. Clair County Health Department, that we endorse and support the new CDC vaccine recommendations. Why is this important? Well, because the state has decided to push back against the CDC recommendations and endorse a totally different set of vaccine recommendations. If the state can choose to do that, we as an independent local health department can do the same. And we can choose which recommendations that we formally endorse as a board. The implementation of the fully online vaccine exemptions. This involves using our resources, spending staff time, developing an online system, which is outside of my control, right? This requires the support of the administration to effect this. And as discussed, as we've seen, MDHHS is using all sorts of legal and administrative maneuvering to push back against the efforts that have been recommended by the board, right? So I view the action of MDHHS as arbitrary. I view it as capricious. This is an agency action subject to the State Administrative Procedures Act. And how does an aggrieved party challenge adverse action taken by an agency? They challenge them in court. Right? So just as we are defending our solar regulations in court, it may be necessary in order for us to defend these changes to take the state to court to challenge their arbitrary, what I view as their arbitrary and capricious interpretation of state regulations, to defend our residents' right to vaccine choice. And then lastly, the MICR opt-out provision. This is simply a matter of our using our agency resources, things like the burst fax, and our public health nursing staff to remind our pediatric practitioners of the need to distribute the opt-out form, right? I could drive around to all the pediatricians' offices and I could say, hello, hey, it's Dr. Nevin, are you doing this? And ask them all. But we have public health nursing staff for a reason, right? Because they have contact with all of the offices. And so what I'm proposing is that we use our staff to measure how common compliance is with the statutory requirement. And then if compliance is less than universal, use our resources to encourage enhanced compliance. What we want to see in the county is if a parent is going to a pediatrician's office to get one of these vaccines, a pediatric vaccine, that they be offered the opt-out form that you see on the final page of your packet. They be offered that form at the time of vaccine administration. That is what the law requires, but for whatever reason, that's not being enforced, and the state, for whatever reason, is not ensuring compliance with that. So as an aspect of vaccine choice, we need to guarantee that parents who want to opt out of MICR are able to do that. Does that answer your question? We're talking about separate administrative tasks, separate from my duties and responsibilities.
So just to be clear, with Exhibit 2 and 7, the state is not accepting the CDC's recommendations.
Well, so what you'll see is that the State Public Health Agency, MDHHS, as a matter of internal policy, is going to be keying its processes off of the recommendations of a medical trade group, right? So as I mentioned in the memo, there are medical organizations that receive a large amount of funding from vaccine manufacturers who have recommended universal use of vaccines. So as an example, the American Academy of Pediatrics recommends that every infant 6 months and older receive the coronavirus vaccine. This guidance has been very clearly been rejected by the overwhelming majority of Michigan parents, right? And so as a public health agency, that we should be sensitive to what the public is telling us. The public is telling us they don't trust those recommendations. The public is rejecting the recommendations of AAP. For whatever reason, MDHHS has nonetheless decided they like these recommendations, they want to implement them internally, right? So they're going to be keying internal processes off of those recommendations. The MICR vaccine tracking system will show that a 6-month-old who hasn't received the coronavirus vaccine is overdue for the coronavirus vaccine. Why? CDC does not recommend it, but AAP recommends it, right? In its promotion to bodies that it funds. So for example, our child and adolescent health clinics, right? As a recipient of CAHC grant funding, we are obligated to, at least accept, documentation and guidance from them. Whether we act on it clinically is a different story, but they will be pushing for the CAHC providers to be recommending the vaccine in accordance with the AAP schedule and not the CDC schedule, right? Now, if you read the exhibit, the final exhibit, I believe it's exhibit, and I'm sorry, I don't have the page on me because I have a smaller version of the packet in front of me. But you'll see there's a document from Dr. Bagdasarian, who is
Exhibit 7.
Exhibit 7, thank you. And you'll notice Dr. Bagdasarian says very clearly that this does not replace individual clinical judgment, right? She can't. Dr. Bagdasarian is essentially an advisor only. She can advise the state health system, but she cannot tell doctors in Michigan what to do. She does not set the medical standard of care. And independent medical directors and independent doctors running their own clinics and working in hospitals are free to advise their patients as they see fit, right? So just as Dr. Bagdasarian and MDHHS can say, as an organization, we formally endorse the AAP recommendations, so can we, as a health advisory board, and so can I, as medical director, say, well, thank you very much for your opinion, but we formally endorse and support the new CDC recommendations as being more in line with obvious public preference.
Thank you.
I'll move to accept this memorandum in support by the Health Advisory Board.
I second it.
As a whole, or each, there's 3 different issues in here?
I would move to accept it as a whole, but that's the discussion.
And you're good with supporting this as a whole? Yes. So again, the 3 recommendations would be accepting the CDC guidelines, essentially, implementation of online exemptions, which Liz, can we just, on discussion for that, we had, and Amy, we had developed that. How are we sitting with that? Where are we at?
We're very close to completion with that. What we're working on is the DocuSign and the ability for both systems, computer systems, to talk to each other. So I would say within the next month or 6 weeks that we could be ready to go with that.
Okay. And do we have an answer from the state?
So I can provide an update on that. So we did meet with Corporation Counsel, and my sense is that additional guidance from the board would be helpful, because the issues at stake here almost certainly will proceed to litigation, right? Our contention is that the state is being arbitrary and capricious in its exercise of agency authority, as we've seen very clearly with Mr. Eberle, right? For simple lack of a piece of paper, his children were quarantined in the principal's office. Police were sent out to his home, and his children continue to be denied the opportunity to go to school. This is malicious, and the fact that they have updated the form, which they say we must complete, now 3 times in the last year in response to our actions, it indicates a degree of legal maneuvering that needs to be met with in kind, right? So implicit in the recommendation is an understanding that we want the state agencies to obey the law. We understand the law to give parents like Mr. Eberle an absolute right to exempt their child from vaccination with a minimum of administrative hassle, which is not present, and the law gives, in extreme cases, physicians like myself, the ability to exempt people that are falling through the cracks of this system. In order for the recommendations of this board to have teeth, we will need to potentially to challenge the state in court. As I've mentioned before, I'm very confident that we will win, because this is very clearly an abuse of agency authority. But if we don't push back against them, they're going to continue to abuse this authority. So what this does is it very clearly directs our health department, our health officer, and the attorneys to assist the Health Advisory Board with this effort, right? So in the interim, we will be meeting with them again. There's some additional documentation that we're going to be presenting initially to the state, but we don't expect that the state is going to play fair, to discuss these issues in good faith, and I anticipate that this is going to have to go to court. So implicit in a endorsement of this recommendation is an understanding that we will fight on behalf of our residents if necessary. And so the question before you is really, is this an issue that is important enough to recommend the committing of county resources to it? And I would hope that the answer to that would be yes.
And it's just a statement, meeting goes long enough. But the motion, I believe, was to accept this in its entirety.
Correct.
And it was seconded. And if you look at the very last Exhibit 9 on the Public Act 368, 1978, the first 4 statements on there, and I think that's what Dr. Nevin's referring to, the law will back the decision of doing this memorandum because it's being skirted by the state right now. What this will do is give it at the county level, and you guys advise as a board. The state law backs this up, and it's good to have that included in the memorandum.
Okay, is there any further discussion?
Going back to my original, is it possible to add to that motion that we also ask for support of the health officer at that time? I'm not sure if you want me to clarify, or I just want to, it seems like we give a recommendation and then it goes somewhere. I, as a board member, I'd like to recommend to the health officer either support or don't support and know where we stand.
Do you want to respond to that, Liz?
I'm
Maybe
sorry,
I'm not-
so you're
maybe I'm not phrasing
recommending
that
in the motion that I follow your recommendation, right? That's what,
Just that we're giving you a recommendation.
okay.
As well as support of Dr. Maybe you could word that better for me.
Well, it could be an addendum to the motion that you could say, and have the health officer support this memorandum or decision.
However.
I mean, that would be in line.
I could amend that motion.
So you're just going to do a friendly amendment?
Okay.
Okay. And are you good with that?
Yes.
Okay. So the motion before the board is for the acceptance of the memorandum and having the health officer support that. Is that correct? Yes. Any further discussion?
I think it's a very good memorandum, it's just it's very clear. I think I really don't see, as far as controversy goes about this, I really don't see, you can get the foundational or the core vaccinations. If you choose to get, the recommended, going in with the healthcare provider and discussing with them for additional vaccines, I think it's a very good, solid memorandum.
Anyone else?
Yeah, I appreciate you putting this together. Thank you. I appreciate the statutory law too, 333.920, little small, 6. And also 333.9215. I think a lot of parents, when they come in, they ask a lot of questions. Education is very important. And ultimately, they need to, they need to be educated by their primary care physician or whoever they're working with, and be able to ask these questions and be able to understand the, system at hand. So, thank you.
Thank you.
Okay. Leanne, you ready to vote?
Are you wanting a roll call vote?
I think that would be appropriate.
That's fine. Klink? Yes. Richardson? Richard, sorry.
Yes.
Folk? Yes. Smith?
Yes.
Urban?
Yes.
Hayes?
Yes.
Standell?
Yes.
The motion is passed.
Thank you. A health officer update?
Oh,
I'm sorry.
Madam Chair, if I could, one more item, not for discussion, with the chair's permission. May I distribute a packet to the members for their consideration either during member comments or at the next meeting? It pertains to matter, I think, of interest.
Okay, can we,
Greg, if you could skip yourself and give that to Liz. And again, if members have questions about this, they can ask during individual comments. This pertains to some guidance from the state to operators of child and adolescent health care centers, which now includes our teen clinic.
okay. If I could ask that we discuss it next month? That would give us, it's a pretty big packet, so it would give us time to read it.
Do you need a motion for that?
All right, Liz.
So tagging on to Dr. Nevin's memorandum, I'm looking for board support. What we'd like to do is put on the Board of Commissioners' agenda in February a manning table change from a full-time RN to a part-time RN. It would better align with our staffing model with current caseload trends while maintaining fiscal responsibility. As things evolve here within our operations, things have to change as the recommendations change. That would allow us to maintain the depth of staff where needed, free up some staffing dollars to further support the part-time nurse practitioner that has been added into the staff here. So previously, so like a year ago or even 6 months ago, we were a one full-time nurse practitioner staff member in nursing. We brought back that part-time nurse practitioner from the Yale Clinic into the main office, anticipating these changes. But the money, we have to move that around without the grant. So we would like to change that full-time RN to a part-time RN, move those dollars over to the nurse practitioner. This does not displace staff. I know that we have staff very much willing to take a part-time position. So I want you to know that this will not displace a full-time person. But I think these changes are needed to align with the recommendations and our budget. So is there support for that?
Yes.
Yeah, I'll support that.
Would you like a motion in support, or?
A motion in support of Liz's recommendation.
As long as I have it, yeah.
Oh, I'm sorry.
No, that's great.
Second.
Thank you. I appreciate that. I think that would be the better way to, as we move forward, do things so that when it comes to the Board of Commissioner level, that Mr. Rushing is aware how everyone feels about it.
Okay, there's a motion and support to take to the county commissioners a staffing reduction from a full-time RN to part-time and moving those funds to the nurse practitioner. Is there further discussion? Dave?
Just because you're going to have to give that answer to us, is this budget neutral?
It's budget negative.
Yeah, it frees up dollars.
Just so we're
Yeah,
going to be asking.
it's even better than that.
Because
Is
that's
that
what we do.
possible?
We watch the money and I'll be asking
Yes.
questions.
Commissioner, it'll save about $42,000.
Okay, that would
Or
be
not
good
save it,
information.
but it'll go towards nurse practitioners.
So it's a neutral then?
It is neutral, basically.
Right. And we can put that in the memo if you think that would be needed.
Dollars that, I go through the numbers very good. Some of the other ones have their specific tools that they're very good. Steve Samaska is a fantastic attorney, Carrie Angie, and we have some very qualified people on the board. But I go through numbers pretty quick.
We'll add that in, for sure. And then second, what I would like to see on the February.
Wait a minute, just one
Oh,
second.
I'm sorry.
We have to vote.
And again, you said this doesn't displace staff, right?
It does not.
Does not, okay.
Does this need to be a roll call, Monica, or no?
No. Is there any further discussion? Okay, all in favor?
Aye.
Opposed? That motion carries.
Second, I would look for some support. What else would be, we would propose to put on that February BOC agenda would be our contract with Courier. That is the courier service that moves our laboratory specimens from our buildings to the State of Michigan lab, to that Bureau of Labs. That is something we have to have using Postal Service, FedEx, those things delay the specimens, so we need a courier service. And that is the same courier, it's not new, that we have typically used, but previously, we've put it on the agenda without bringing it to this board. So I want to make sure we answer any of the board's questions and have some support.
Liz, where would that be on the accounts payable or the summary of budget?
Good idea.
No, I'm just wondering where that is, sorry.
The total?
I'm not sure. It could be charged to multiple board keys, probably general nursing, 601.
And the typical amount?
It's about $500 a month, which is probably cheaper than postal shipping services.
It's a daily pickup here. You know, where we put the specimens in they come after hours, pick up the specimens, get them there.
Is there a motion in support for that?
I'll make a motion.
I'll support.
It's been moved and seconded to support signing the contract for the courier service to the Board of Commissioners. Is there any further discussion? All in favor?
Aye.
Opposed?
Okay, and then just within your report that you have in your packet, I just want to highlight some quick things. The board did approve that 5%, approximately 5% increase for our environmental health fees, and those began January 1st. It's also radon kit month, so we're doing the free radon kits. We're giving those out at the health department across January. And then you'll also see new this year is that those outcomes will be tracked, and locations with elevated results will be provided an additional test kit by mail and offered education at that point. So previously, the kits were handed out, and we didn't get results back on who actually had elevated radon or provide them any assistance. That is new this year. Next, for the new members, you see going through there, we put in a lot of caseload information there for Children's Special Health Care Services. We had a November caseload of 726. Maternal Infant Health Program, that's our home visiting program for pregnant women and infants. Our caseload was 259. Moving down, we go into lead and lead case management that we do. The number of tests that were done, 55 capillary, which is a screening test done here in-house, and then 80 outside of the health department that are reported to us to follow up on and see that venous confirmation test gets done, looking for those continued elevated levels, and then we offer them case management services at that point. WIC numbers are outlined as well. Our November enrollment was 2,275, and we were at a high 89.89% participation. I think 90 is the goal, that 90% are participating actively there. That is a measure for the WIC department that they're looked at. CD
It's actually a
referrals.
big improvement.
It is a big improvement. They've done a lot of hard work to make sure that participation at different models are available for individuals, yeah.
Good.
Next, we go into communicable disease, and you can see there'll be a brief update there. So just to highlight, new communicable diseases that were referred to us for investigation are broke out into respiratory type, there was 151. Non-respiratory, there were 69 total, and then there's just some comments about things that are maybe outside of the norm. In our personal health and family planning clinic, they're above their caseload goals there. So total family planning visits for the year, they're on a calendar year measure, were 1,000 311, so that was above our caseload goal. I believe the same caseload goal was set for this year as well. Moving into planning, promotion, and education, just a highlight of the client feedback. So we do client feedback, short surveys on anybody receiving our services, and there were 44 responses with an average rating of 4.8 out of 5, and where that might not seem like a lot of responses, again, for new board members, we transitioned to the electronic system of surveying our clients probably in the last 2 years, where we were getting slim to none responses when they were on paper. But we still have the paper cards available for those who opt out of that. And I believe that's all I have unless there's questions.
Steve, has there been pushback on the rate increase? Good. Yeah. Okay, items from members. Does anybody have anything?
I do. I have a few things.
Go ahead.
I know we don't normally address the public, but I do want to just give a few statistics that I went through. So first of all, in our bylaws, Article 2, Section A2, it does state in there that our mission is to enhance government presence locally and assuring that conditions in which people can be healthy and recognizing that persons have a right to make a health decision about one's body and one's self subject to established law. To that end, all actions of the St. Clair County Health Department Advisory Board of Health shall strive to ensure that our citizens and their children maintain their inviolate right to medical decision, autonomy, and self-determination over their own body and their children's, to recommend policy for the St. Clair County Health Department. So with that being said, I went through the autism rates just so that, you know, with the vaccine schedules. In 1970, the autism rates were 4 in 10,000. In 1980, that's the earliest I can find the vaccine schedule, we gave only 7 doses, which, I mean, I got them all. The DTP, the polio, that was at 2, 4, and 6 months, and then the MMR. In 2000, the autism rates went up to 6.7 in 1,000. So from 4 in 10,000 to 6.7 in 1,000. The vaccine schedule in 1999, so just before that, that year, there were 16 doses by age 2 of vaccines that were then required. In 2020, the rate went up to 27.6 in 1,000. So increased by 4 times the amount. At that time, the schedule was 24 doses by 1 year old. And then now in 2022, the rate was 1 in 31, which essentially was like up to like 30, I think it was like 33 in 1,000. So that schedule was 25 doses by 18 months. So in the medical field, science is always changing. It's good to question science because that helps us change and learn more. You know, maybe we were wrong at one time, and that happens in medicine all the time. Medicines have been approved by the FDA, and then years later, after we gave it for X amount of years, it's now considered cancer-causing or detrimental to the health effects, or it could cause heart attacks. So those medicines are taken off the market. That has happened numerous times in my 25 years of practice. As a physician associate, not a nurse practitioner or a nurse. So with that being said, why is it wrong to question science? That has been, or always has been, as Dr. Nevin said, the status quo. When the COVID vaccines came out in 2020, in December of 2020, I watched the FDA approve those via Zoom in under 15 minutes. When the scientists, it was made up by a panel of doctors and scientists, one doctor tried to ask a question about the safety of an mRNA vaccine because all the animals in that study had died. And the chair of that board said, "We don't have time, we need to push this through now." And that was an experimental vaccine that they rubber stamped right through without doing their due diligence. So now it is known that science was wrong because it has been shown to cause an increase, and this is right on the vaccine side effects, myocarditis, pericarditis, immunosuppression. In my practice, I've seen an increase in heart attacks, atrial fibrillation, strokes and blood clots, turbo cancers, rare cancers and rapid cancers, recurrence of cancers, flare-ups of autoimmune conditions, neurological conditions, rapid progressive dementia, and decreased immunity across the board. So there are some times that science does get it wrong. So questioning science, that's a good thing. I spoke with a professor down at the University of Florida who treats Guillain-Barré. If none of you know, that's like a neurological condition that oftentimes is related to vaccines. She treats about 200 patients that have Guillain-Barré syndrome, amongst many others. She said she encouraged every single one of them to get the COVID vaccine. All of them that got the vaccine has had a flare-up in their neurological condition that has been intense, severe, and prolonged. And one of those patients that she treats is my patient that travels down to Florida every year and gets treatment from her. So.
Okay, stop, please.
So.
Sir. No.
So this is.
Order, please.
So with that, I applaud the CDC for slowing down and, looking at those. These vaccines have never been studied all together, all at once. They've only been studied separately. So it's okay to question. If something's going to harm our children, we want to know, and we want to make sure that we're giving our children only the best, because our children are our prize. Yeah. So that's it. Thank you.
Is there other?
Yeah.
Order.
I got something to say. We were talking a lot about bodily autonomy here in this last month, so I wrote this up yesterday. Public health exists to protect communities, but it must do so without abandoning the ethical standards that give it the most legitimacy. One of the standards, perhaps the most important fundamental, is respect for bodily autonomy and informed consent. Bodily autonomy means the individual retains the right to make informed decisions about their own bodies, free from coercion or undue pressure. This principle is not new, controversial, or political. It is a cornerstone of modern medical ethics, established in response to historical abuses where individuals were subjected to medical interventions without consent, often in the name of the greater good. True informed consent requires more than information alone. It requires freedom of choice. When medical decisions are tied to threats of job loss, exclusion from education, or denial of services, consent becomes coerced, not voluntary. Public health should never place individuals in a position where compliance is extracted through fear or penalty. It is also important to recognize that risk is not uniform. People differ by age, health status, genetics, prior exposure, and personal circumstances. A one-size-fits-all approach cannot ethically replace the individualized decision-making made in consultation with a trusted healthcare provider. Respecting bodily autonomy does not weaken public health, it strengthens it. Trust is the most valuable currency public health has. When people believe their concerns will be heard and their choices respected, cooperation increases. When autonomy is dismissed, trust erodes, resistance grows, and public confidence declines. Supporting bodily autonomy, it does not mean opposing science or community health. It means affirming that ethical boundaries matter, even during difficult or uncertain times. Public health is strongest when it protects both population well-being and individual human dignity.
Thank you. Anybody have anything else?
Yes, Monica. In the past, I believe it was October, November, definitely in December, the Board of Commissioners had asked questions regarding the Advisory Board of Health to do an evaluation for Liz. That had been discussed. There was no formal evaluation form, no information that we had to obtain that. Liz did give us her self-evaluation. Over Christmas break, I did come up with a brief one for us to review and look at, edit, do whatever, so that we have that at the Board of Commissioners' wishes. And I would like to distribute that.
Okay.
It's not a motion, it's
No,
just for us to review.
no, that's fine. She did have a review done, though, by Carrie Hepting. It was done, correct?
Yeah, it was a review and goal setting, where she received a
Yes.
similar document that
I
you
did
did.
see that, okay. My understanding was that we were supposed to do that according to the Board of Commissioners?
So, again, if we go into our bylaws, it was supposed to be taken out of the bylaws. And I'd have to review our bylaws again, but a review was done.
Yes,
So-
I'm acknowledging that
Okay.
Liz had done the review.
Yeah.
I'm not saying that she didn't.
No, that Carrie did, like, one was done by some, like, she did have a formal evaluation done. And again, we had taken it out of the bylaws, and how it got printed back into the bylaws, I'm not exactly sure. But
I don't think that was a bylaw issue. I think that was a contract issue, from my understanding.
yes, it was in her, I'm sorry, it was in her contract. It got taken out of our bylaws, but it's in her contract. And then I would have to have her contract in front of me, because I don't, it said a evaluation had to be done. So, I took it as a done deal because Carrie did it. But if you want us,
It's 4 questions. It's not really hard. If you want to add 1 or 2, it's not that big a deal. It was a general, just, hey, where are you at on these things?
yeah. Yeah, it's perfectly in line to pass those out.
I have her contract.
Thank you.
If you want to look at that.
Yeah,
It specifies.
Right.
that Board of Health.
right, it does. And again, that, I guess, moving forward, we should have that removed and have, or decide on which way it should be. So. Yes.
I carry contracts with me, so I got Dr. Nevins and Liz King's with me, but you've already seen it. It is in the contract, and it's a requirement of this board to do the review until it is changed.
Right.
Currently, we're looking at both contracts, and Thomas Hull is going to be working on that. Probably get you guys with some recommendations to the corporate council right now to make sure that the recommendations that are going forward, but I believe that part of it is going to stay in the contract. So,
At the advisory board.
yes, for the advisory board to do the annual review.
Okay.
But until it changes, it is what you have, and if you guys need to,
Right.
part of your back.
Okay.
Or part of the contract.
So if everyone could review this and then bring it back for next month? Yes.
I would just add that the point of all this was to strengthen us as a board.
Mhm.
I appreciate the opportunity.
Okay, thank you. Did you have anything else, Leanne?
No, ma'am.
Okay. Does anybody else have anything? I would just like to welcome both our new members. And touching on somebody in the audience, a lot of people talked about vaccination rates. When I started on this board, I believe we were 81st of 83 in the county, or in the state, in our vaccination rates. And we are currently 60, do you know?
For Dr. Nevin.
What is our current vaccination rate? Where do we rate as a county?
I believe we're in the bottom third, which is not surprising given the,
Right.
given the demographic makeup of our population. I ran a statistical analysis of our state vaccination percentages by county. I looked specifically at the hepatitis B birth dose, and I looked at demographic factors that correlate with or predict the birth hep B dose. And an overwhelming majority of the variance in hepatitis B birth dose across counties is predicted by percentage voting Republican in that county, which means that, well, you know, there are chuckles from the audience, but this is very important because it indicates that public health policy should, if it's reflective of the values and priorities of the public that it serves, it should roughly correlate with county party preference. We all know this intuitively, right? But the data support it. Now, interestingly, MDHHS has a policy that states it will not discriminate in the services it provides, in the way it treats residents, based on their party affiliation. But if vaccination uptake is most strongly correlated with party preference, then isn't MDHHS, by forcing individuals who clearly don't support vaccination, if MDHHS through its policies is enforcing vaccine mandates against the will of individuals based on party preference, isn't that discriminatory? I think many people intuitively feel that way, but the data actually support that.
So back to my original point, I believe we are 64, 67, yes.
The quarterly immunization report card, which is through September 30th, has St. Clair County for 19 to 35-month-old.
Yeah.
56 in the state.
Oh, so we've had a significant drop. Oh, 56%.
Well,
We're 56. Oh, then we've done really well. We've improved. We were 81. So while there's still work to do, I think that we do vaccinate our kids. So that's all I have. Anything?
No?
Yeah.
You are correct, the figures just given, we're at 67% out of 83.
Okay, I thought I read that, but I kind of watched that just to see how we do, but, because when I got on the board, we were 81 and I was appalled.
So like 81 on the bottom?
Yeah, so out of 83 counties, we were the 81st.
Okay, so we moved up.
So we've moved up, that's correct. So we can certainly do better.
Madam Chair, if I could, I've advised our staff that we need to be very careful in defining what is a metric of success. So until recently, the state was very adamant about defining a percentage of the population that they insisted was vaccinated against flu every year, and it's quite high, 60, 70%, I believe. And the public's clearly not having any of that because every year consistently, only about 1 in 4 choose to get vaccinated. So I would propose that this is the wrong metric. The correct metric is not what percentage of the population is vaccinated against disease X. That's not the correct metric. The correct metric is of individuals who consent and who are in a position to give full informed consent. What percentage of those individuals received the vaccine that they chose? That's the correct metric. That is the metric that I believe should guide our actions, because to do anything else involves coercion. It ultimately involves coercion. And we've heard very clearly today from members of the public, and we've seen clearly, based on individuals' own stated preference through their actions, that individuals want choice. And so I believe the correct metric is of individuals who are in a position to give full, uncoerced, and informed consent to a given vaccine. How many of those are vaccinated?
When we talk about disease eradication, or disease control, for example, measles, it really is about the numbers. And children can't obviously give full consent, but parents can. So I'm fully in favor of parental choice or parental rights. But I think we do have to look at it as the age group, because those are the ones that are going to drive that. So.
Madam Chair, if I could, there's a lot of public confusion about the third-party benefits of vaccines. So we're fortunate in that the earliest vaccines that came into use provided what we call sterilizing immunity, meaning the body essentially no longer serves as a host for the given pathogen in question and is not able to transmit the given pathogen onto other people. So the classic example of that is smallpox. Right? You get vaccinated against smallpox, you develop very robust mucosal and humoral immunity, and even if you come into contact with someone who's unvaccinated, as a result of your vaccination, you not only don't get sick, but you're unable to harbor the virus to transmit to others. And unfortunately, what occurred is that the public became misinformed, that is a property that applies to all vaccines. And in fact, that's not true. The majority of vaccines that we use today do not provide any significant or meaningful third-party benefit. Smallpox, absolutely. Measles, mumps, rubella, varicella, hepatitis B. But the overwhelming majority of other vaccines don't provide sterilizing immunity, and they don't necessarily block the onwards transmission. A classic example of that, of course, as we've all learned, is the coronavirus vaccine, right? We were all told that you must get the coronavirus vaccine so that you don't kill grandma, right? That if you get the coronavirus vaccine, you won't get sick, you won't transmit the virus to other people. And we know that that was absolutely not true, right? And look, the public is furious. The public is furious about having been misled on that point. And the numbers speak for themselves. 90% of Michiganders, even a higher percentage of St. Clair County residents, are not receiving the coronavirus vaccine this year. Why? Well, we'd have to ask 9 out of 10 people why, but I imagine it's in some part due to the fact that, fool me once, shame on you, fool me twice, shame on me. Coronavirus vaccine does not significantly block transmission. Influenza does not block transmission. Most of the vaccines that we give to kids do not block transmission of the disease. We're unfortunately learning that with pertussis, which does not serve to block transmission during outbreaks of whooping cough. So the argument that many people make in support of increasing vaccination percentages generally does not apply. There is an argument to be made that widespread vaccination, for example, against measles, is beneficial to the very small number of people that can't be immunized. But we cannot be in a position where we force this on people. The public has very clearly spoken that they are rejecting mandates of this nature. So what we must do is we must identify the factors that have contributed to the decrease in uptake of these core vaccines. And what we see is that a primary motivation behind the rejection of these core vaccines, MMR, is distrust. And for good reason, right? The reasons the individuals that don't get the MMR vaccine do not trust the vaccine, they have sound reasons for doing so. And simply telling them that they're misinformed, that they're ignorant, that they're religious zealots, or whatever insults are hurled at what we call anti-vaxxers, is not going to solve the problem. And so for those that wish to increase vaccination uptake in this population, what is it that's being proposed? Are we proposing that we tie these people down and force vaccinate them? Well, certainly I hope not, right? Are we proposing taking away the exclusion, the ability to exempt their children from vaccine requirements at school? I certainly hope not, right?
Kev, you're out of order. You are out of order.
So, Madam Chair, thank you.
Folks, you are out of order. Stop. Kevin, you'll be, Mr. Watkins, you will be asked to leave if you cannot hold. I'm going to have to ask you to leave if you cannot. Can you be?
Kevin, and everybody in this room, you're going to stop or I'm going to call the sheriff. I'd say adjourn the meeting.
Yeah. Motion to.
I move to adjourn the meeting at 11:29.
Second.
It's been moved and seconded to adjourn the meeting. All those in favor?
Aye.
Opposed?
I will ask the sheriff to be here at your next meeting.
Bring him here now. You know, we just leave this here. Yeah.